It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, get peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was, my wife wants to die in intensive care after she had a lung transplant. What should I do? You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from our readers that we get quite frequently. And the question this week is, how long can a breathing tube or an endotracheal tube stay in? This is a very common question we get from our readers here at IntensiveCareHotline.com. How long can a breathing tube or an endotracheal tube stay in when your loved one is mechanically ventilated in intensive care? So let's get right into it. Now, as a rule of thumb, a breathing tube or an endotracheal tube is usually staying in your loved one's throat or larynx for up to 2 weeks at the most, unless there are special and rare circumstances, and I'll come to that later. The reality is that most critically ill patients in intensive care only require mechanical ventilation with ventilators, also known as a breathing machine or a respirator, with a breathing tube or an endotracheal tube for a limited period of time. Most mechanically ventilated patients in intensive care only require ventilation with a breathing tube or an endotracheal tube for a few days at the most. If your loved one is mechanically ventilated and on a breathing tube or endotracheal tube, they will also be in an induced coma. Now, if you don't know what an induced coma is, please scroll down below this video where you can click on an article and a video. What is an induced coma and why is my critically ill loved one in an induced coma? And if you are watching this on YouTube, just click on the link below this video. That'll get you to our website, to the written version of this blog, where you can find all links to other videos and articles. So coming back to the original question, how long can a breathing tube or endotracheal tube stay in? Now, as I said, normally it's not longer than a few days, but there is obviously always the exception to the rule, of course. And if your critically ill loved one requires mechanical ventilation and the breathing tube for more than a few days, potentially 7 days and longer, a tracheostomy might be a next step, but I'll come to that later and have some more information about tracheostomy further down the line. The most common reasons for mechanical ventilation with a breathing tube or an endotracheal tube in intensive care is post-surgery, trauma, lung diseases such as pneumonia, ARDS, also known as lung failure, COPD, acute severe asthma, and also other admissions such as pancreatitis, burns, heart attack, cardiac arrest after cardiac surgery, and the list goes on and on. So therefore, the list when a breathing tube or endotracheal tube and mechanical ventilation is required is not exhaustive by any means, and I only mentioned the most common scenarios in intensive care where mechanical ventilation with a breathing tube or an endotracheal tube is indicated. But because the question that we get asked quite frequently at IntensiveCareHotline.com, how long can a breathing tube or an endotracheal tube stay in your loved one's throat? The answer is that it can almost stay in indefinitely. That's certainly not a desired goal, and again, normally doesn't happen. Normally, I would say that up to 2 weeks is the longest that I have seen. But again, there has been the exception to the rule. If a breathing tube or endotracheal tube stays in for more than 14 days, there are usually unusual circumstances requiring the breathing tube or the endotracheal tube stay in for longer than clinically recommended, such as extubation, which is the removal of the breathing tube, is close and only a few more days away, or the anatomy of a critically ill patient doesn't allow for a tracheostomy to be performed, for example, if there is a short neck, or the other indication for a breathing tube staying for more than 14 days is airway swelling. That basically means that the throat is narrowed through swelling, and by the time the breathing tube comes out, there would be a blockage of the throat, and therefore your loved one would suffocate. That's another indication why a breathing tube sometimes stays in for longer if there's airway swelling. Treatment for airway swelling is sometimes adrenaline nebulizers and steroids such as hydrocortisone. So usually what happens if your critically ill loved one is requiring ongoing mechanical ventilation and it is foreseeable that extubation or removal of the breathing tube is not on the horizon due to the critical illness of your loved one, normally a formation of a tracheostomy is the next step indeed. A tracheostomy is another tube that is permanently or temporarily inserted into your loved one's neck in the windpipe going directly into the lungs. This tracheostomy tube is making it a lot easier for your loved one to be mechanically ventilated as the tube is no longer in the mouth. And it's easier to be weaned off the ventilator as ventilation with the tracheostomy doesn't require a huge amount of sedation compared to the amount of sedation needed when your loved one requires the breathing tube through the mouth. Now, you might also want to look at other articles and videos that we have on our website. For example, you might be interested in how long should a patient be on a ventilator before having a tracheostomy. Another article that ties right in with that topic is what are the risks and the benefits of a tracheostomy. And another article and video relating to this topic is why would a critically ill patient in an induced coma need a tracheostomy in intensive care. Again, if you are on our website, please scroll down below this video in the written version of this blog where you can access the other articles by clicking on the links. And again, if you're watching this on YouTube, please click on the link below this video so that you can get access to our website. Now, the other advantage if your loved one has a ventilator is often the ventilation can intermittently or permanently be removed to find out how well your loved one is breathing without the ventilator. And generally speaking, and it's much easier that your loved one can be looked after, as a tracheostomy is much easier for your loved one to tolerate and is also less risky than a breathing tube or an endotracheal tube. Furthermore, a tracheostomy tube can stay in indefinitely, and in fact some people have a lifelong tracheostomy tube in place and they can often live with it independently. Also, by the time your critically ill loved one comes off the ventilator and the breathing tube or endotracheal tube is removed, they will need to be awake and have come out of the induced coma. They need to be able to cough, breathe by themselves, and they need to be able to follow simple instructions such as squeezing hands, etc. For more information how to wean your loved one off the ventilator and the breathing tube or endotracheal tube step by step, please again check out another article and video, how to wean a critically ill patient in intensive care off the ventilator and the breathing tube. You can go and find that link again below this video in the written version of the blog. One of the reasons why your loved one may not be able to come off the ventilator is that they haven't woken up from an induced coma. And again, here is more information what to do if that's the case. Again, I wrote an article and a video about how long does it take to wake up after an induced coma, and you can find that link to that article and video below this video. I hope that answers this common question that I get all the time, and if you have any further questions, please send your questions to support@intensivecarehotline.com. So, how can you make informed decisions, get peace of mind, control, power, and influence quickly once your loved one is critically ill in intensive care? You will get to that all-important feeling of peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free instant impact report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind the scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section where you get more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. You can also call me. Find international phone numbers on the top of the website. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. Also, have a look at our product section where you get more ebooks, and you can also get one-on-one consulting and advocacy with me via Skype, over the phone, and via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.